Today, Dr. David Nicholl is a consultant neurologist. He's from the Doctors Association UK, and he has been on shift in a hospital emergency department this morning. Good afternoon, Happy New Year. How was it?
To put this in context, I'm a consultant neurologist, been for 20 years, so I'm on call at the moment for stroke. I've literally just got off the phone dealing with a stroke call. I was in emergency department this morning, and I saw more people on gurneys than I've ever seen in a corridor. I'm sorry, what the Prime Minister said is wrong. You know, and I'm sorry, this is the standard answer which comes from the government. You know, they go, blah, 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 we're sending record sums of money on the NHS. And I say, well, that's because we've got an increasingly ageing population. And it's really frustrating at every level, and you just feel like apologising to patients for the level of care which is nowhere near what you would expect in a first world country. I think we should be ashamed. And I think the patient I saw who was stroke alert, obviously I'm speaking in a personal capacity here, not speaking on behalf of the Trust. That's why I'm here on behalf of the Doctors Association, and that's why I can be as candid as I am. But let's put it this way, I saw a patient who came from Solihull to Sandwell, and that was because all the hospitals are under alerts at the moment, and apparently R1 is less bad than Heartlands. Well, I saw an awful lot of people in corridors today.
Do you dispute...
So things must be really bad in Heartlands.
Do you dispute the fact that the government is putting in more than it's ever done before?
No, I don't dispute that. But that's the standard answer that is given.
What should they say?
Well, they have failed for the last 12 years to deal with social care, and they've failed to deal with the issues of increasing ageing population, and all the things that were said just before talking about how we were in a crisis before the pandemic, and it's just got worse. They failed to deal with the pensions issue, absolutely singularly failed to deal with retention of staff, just this kind of blah, 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 we'll get extra numbers of doctors. Well, if people are leaving, either from retirements or going elsewhere or leaving medicine, okay? I've got a colleague, 52, was clinical lead in her specialty, who's leaving the NHS completely, not going anywhere else, okay? Okay, her husband's retired. And that's a crying shame. People are fed up with the back teeth. And frankly, I'm fed up with that kind of crap, actually, that gets told by, not just the Prime Minister and others. You look at the Health Secretary yesterday, talking about the bloody NHS app, okay? NHS app is not going to solve the people stuck on gurneys in emergency departments throughout the country.
Okay, I'm
sorry, I really feel angry about
No, listen, it's fine. I completely get your anger, and I've seen it round the family dinner table. I've seen it when I've been to see my mum in hospital. I've seen it everywhere. I really get it.
If I put it, I've got a friend of mine who's a senior nurse who's currently stuck in Redditch Hospital, who's got acute appendicitis, who had her operation cancelled yesterday. So actually this is having a direct effect on, that's someone who will end up having a longer stay in hospital, and therefore it's going to be harder for her to come back to work to treat patients.
So look, if we're not disputing the fact that the government is actually putting in more money than it's done before, we have got a paucity of every particular service within the NHS. There are holes in the workforce everywhere. What is the first step to trying to make this a bit better?
Staff retention has got to be top of the list.
Mm-hmm.
And I think that's pensions issue. Look at what happened with the judges. That's got sorted. That has not been sorted.
What's wrong with the pensions? Just literally not enough, or what?
No, it's an issue that actually, if you're trying to deal with a backlog, okay, basically you're expecting staff to work for free.
Mm-hmm.
That's never going to work, okay? So people are retiring or reducing their hours to avoid getting large tax bills to come to work.
Right, okay. I know people who've retired who take their pension but then get re-employed because there's not enough staff on freelance rates. Is that a satisfactory way of working?
No, it's not. But in fact, what usually happens, and correct me if I'm wrong, I'm making a guess here of your friends, is that they probably come back on reduced hours, okay?
Yes.
So maybe work 2-3 days a week.
That's right.
So that's someone who could be full-time, but actually they're reducing the hours to avoid getting a five-figure tax bill, basically.
Okay.
So that would make a massive difference, and we've been banging on about this for years.
Let me ask you about freeing up beds, because this is one of the key things that we've all learned about this year, or last year, sorry, and that is ambulances waiting outside A&E, trying to offload their patients, but not being able to because there are no beds free. How do you start to make that better?
You have to deal with social care. An app won't deal with that. So the whole social care issue, and there's a real problem there because I'm afraid it does relate to salaries. You've got staff who work in care homes. It's better, that economically makes more sense to them to work in oldies than work in a care home. And we have failed to do that. That has been kicked down. That can's been kicked down the road time and time again.
So when you say deal with the social care issue, these are elderly patients, and they cover most of the beds in hospitals. These are elderly patients. We can't get them into the social care system because what?
Either because there aren't places, okay, or just because there's been, if you look at well over 120,000 vacancies in social care, that issue has not been dealt with, okay, and if you look at...
But why is that a government-induced problem, the fact that not enough people work in social care, there aren't enough beds, there aren't enough spaces?
Because we have failed to actually address the problems of social care. You will have heard these stories many times of people selling their houses and things like that. So I'm afraid there isn't a quick fix for this, okay? But the reality is we've been talking about this for years, okay? And I can't solve this week. And in fact, the reality is I think things are going to get worse in the next couple of weeks, because to see the situation as bad as it was today on New Year's Day, and normally things get really bad, not today, but in the next week or so after New Year. Things are bad now, but I'm sorry, they're about to get worse.
All right, well, I better let you go. You sound like you're fairly busy. David, thank you. Appreciate it. Happy New Year, if indeed it could be called happy.